have lots of different treatment options for patients with IBS. We have antispasm medications to help calm down the GI tract, because what often happens is that with the stress and anxiety, the colon starts to spasm and cramp, and that's what causes pain. We often use antidepressants in patients who have IBS. And I do counsel patients, first off, only the most severe cases of IBS need antidepressants. This is not a first-line medication, but in those patients who do need it, the dose we use is much lower dose than the dose we're using on the brain, because we're not really necessarily trying to target the brain. We're trying to target that enteric nervous system, that gut nervous system. And research studies have shown that it is helpful in patients that do have severe IBS. Sometimes we just treat their symptoms. We can use antidiarrheals if they're having a lot of diarrhea, or we can use pro-secretory agents if they are having constipation. There's another medication we can use. This is called rifaximin. Interestingly, this is an antibiotic, but it's a non-absorbed antibiotic. So when you consume it, it is excreted out of you. But it's FDA approved for the treatment of irritable bowel syndrome with diarrhea predominant, based on this theory that patients with IBS have an abnormal gut microbiome. And in a large double-blind study, which is really the kind of the hallmark and the best studies that we can get, they found that 40% of subjects had an improvement in pain and inconsistency. So one thing that's very important is appropriate toileting. This is a picture of my middle daughter when she was younger. And it's, interesting because when you watch babies and children, they instinctively know the right healthy way to poop. The squatting position is actually really healthy for helping to move things through our GI tract and to help get excreted. With our current toilets, we don't use the squatting position, and that actually can cause a lot of constipation in people. One thing that can cause constipation is pelvic floor dysfunction. We all have muscles in our anus and in our bottoms. We actually have kind of two muscles. When we want to poop, those muscles should open up and relax. When we don't want to poop, they should stay closed so that we don't leak all the time. In many patients, those muscles no longer work. For some reason, they have become discoordinated or uncoordinated. And what happens is, instead of opening up to when they want to poop, it closes down when they're trying to poop. And so people might feel like they have a blockage. They feel like they're not emptying all the way. That could be a sign you have a pelvic floor issue. Up to 50% of patients who have a slow colon resulting in constipation will also have a pelvic floor dysfunction. So it's definitely something that needs to be evaluated, because we have different treatment options. All right, let's get back to talking about diet. So we've talked a lot about the symptoms of IBS: anxiety, cramping, bloating, fatigue, abdominal pain, brain fog, vomiting. And we have medications like we talked about to help treat some of those, but those are really treating the symptoms. The main issue with irritable bowel syndrome is that the gut microbiome is altered, and that thin layer of cells that's preventing things from going from the gut to the blood becomes altered. You get gut bacterial dysbiosis, and you get gut permeability, which many people call leaky gut. That is the root of the problem. So one of the best ways to address that issue, to get to the root of the problem, to fix it so you feel better, is diet. So what we eat greatly impacts our gut-brain axis. The foods that we eat can impact that gut barrier function. This is that thin layer of epithelial cells that we talked about. And depending on the foods we eat, we can do things that are going to improve the gut barrier and produce things like short-chain fatty acids and amino acids, or things that we eat can actually harm those, get a leaky gut. What that means is these are called tight junctions. It leakens and it worsens this barrier, and you can get, for example, increased bile acid production. So what we eat is going to make a difference. The diet that I recommend for my patients, because I believe that the research supports it, is a whole food plant-based diet. This was a research study done by Rob Knight in 2018 through the American Gut Project. What they did is they looked at stool samples from over 10,000, we call them citizen scientists. So what that means is they took stool samples from people like you or me. They took people in the community and they asked whoever's in the community in your normal environment, we want to collect your stools to see what kind of microbes are in the wild or are in your body normally and naturally. Because many of the research studies that are done are very controlled. We're regulating people, we're watching people, and we just kind of want to know what's going on. And they found that eating a variety of fruits and vegetables is the single best predictor for good gut health. In fact, when they kind of did the research study, they found that any people who ate more than 30 different types of fruits, vegetables, whole grains, they had the healthiest gut microbiome. Now, I don't think there's necessarily anything really special about the number 30. I don't think having 33 versus 27, for example, is going to make much difference. But I think that the point is that we want to eat a variety of fruits and vegetables so that we get a variety of different gut microbes in our GI tract. That's very important. We want a variety of healthy strains. I actually see a lot of patients in my office who come to me and they have a lot of these GI tract symptoms. They have some IBS symptoms and they do eat healthy, but they eat the exact same thing every day. They'll have the same salad, the same vegetables, the same fruit. And while that's good, what you're basically doing is selecting for those gut microbes that like the foods you're eating. So if you eat a lot of broccoli, you're going to get gut microbes that like a lot of broccoli. But what about increasing the gut microbes that like a lot of asparagus? Well, in order to get that, you're going to have to eat asparagus. So variety is very important for your gut microbiome. So this was a study published in Nature. Nature's like one of the top medical research journals. And what they did was they looked at a plant-based versus animal-based diet and how did these diets compare? So they found that there's higher fiber intake in those people who consume a plant-based diet compared to animal-based diet. So importantly, fiber comes from plants. So that's a key point there. And they also found more gut microbiota diversity on a plant-based diet compared to an animal-based diet. So again, that's really an important point if you want to be healthy, and let's all lower our chances of getting chronic medical conditions, chronic inflammatory conditions, is getting gut microbiota diversity. And then interesting, they found that differences between those people who switched to a plant-based diet or an animal-based diet, they found differences in the gut microbiome just within one day of the diet reaching the gut. So changes can be made very rapidly.